Concentrating on Oklahoma's 45 to 60 age group, what can that group do to avoid a joint replacement?
There are several non-operative interventions we can perform to try to delay the need for joint replacement. One being activity modification, which is to avoid heavy activity, running, jumping, heavy lifting. Also, interventions such as anti-inflammatory medications, pain medications, physical therapy. There are even some bracing techniques where we try to offload the compartment of the knee that is arthritic in order to decrease pain and increase function. Also, injections are a very widely used method of non-operative care for degenerative arthritis. There are two basic medications that are used pretty much worldwide and have gained acceptance. One is steroid medication with local anesthetic, which is a very powerful anti-inflammatory that we deliver locally to the joint itself to decrease pain. The other medication is hyaluronic acid, and it is usually given in a series of injections. It serves to increase the viscosity or thickness of the joint fluid, which has an anti-inflammatory effect. It also lubricates the joint and helps with motion mechanically by lubricating the joint to allow it to move in a more smooth fashion and therefore decreasing pain. The most common symptom that brings us to seriously consider joint replacement is pain. But there are a few other, I think, very practical issues that can come up with degenerative arthritis that are somewhat pain-related, but tend to affect us in very practical ways. One is sleep. If you're not sleeping, if the pain in your knee is keeping you awake and you're not able to get to sleep, or if you are, it wakes you up, and you're not getting good regular rest, that can affect your health in general, your overall outlook and mood, and makes surgery a more serious consideration. Also, if you feel you may fall. We have many times we see fractures of the hip, the shoulder, the wrist, the elbow in folks that have degenerative arthritis in the weight-bearing joints, the hips or the knees, and they have tried to delay surgical correction for months or years, and they end up with a very serious injury that takes months of rehab to recover from, especially when you combine that with an already degenerative joint in the weight-bearing extremity. Makes those injuries especially difficult to recover from. So I would say, if you're losing sleep and also feel you may fall or have fallen, those two things, as well as increasing severe constant pain, make surgery a very real and serious consideration.